like any other morning. My first thing is always take the dog out. And she got up and went to the bathroom, and all of a sudden I just went but a few minutes, I heard something like a knocking. When I went in there, she was like down like this, sitting on the toilet. When I pushed her back, she had like a face expression. She couldn't even talk to me, and this whole side here was just drawn up. She could not respond to me. I called 911 and they got to her.
She first presented to the Marion ER, and where they did a non-contrast head CT. It was over the weekend. It was a Saturday morning, about 7:30 or 8 in the morning. I happened to be at our office reading the CAT scans, and my partner pulled it up and questioned a dense left MCA sign. Sure enough, it was a dense left MCA concerning for a large left MCA territory stroke. So I called the ER physician, recommended transfer.
So before she arrived, we had notification she was coming. My main job is to continue that pathway, alert the neuroradiologist and also our neurologist so that they're aware if she's about to arrive. I also contact our CT scan and make sure the table is empty and expecting her. As she arrived from the helicopter pad, she wasn't able to talk to me. She had a big facial droop and she couldn't move her right side. So this was signs of a very large stroke affecting the whole left side of the brain.
So myself, Dr. Gudovitz, and the nursing and the CT staff were all ready. So the second she hit the door, we rolled her immediately to see the CAT scanner, saw that she had still the large left MCA occlusion and that her CAT scan allowed us to perform the procedure.
And then the procedure is called a thrombectomy, where they remove the clot. It's all done through an arterial access, so not through the skin.
And we took her immediately to the interventional radiology suite where our technicians were already ready and the whole operating room was ready for the procedure. By the time we got access, catheter in the head very quickly, and our first attempt at removing the clot was quite quick. I think it was under 30 minutes. Her clot was extremely difficult to get out. We got it open immediately when I was there, but then the vessel kept shutting back down. I had worked a long time, about an hour and a half.
When I first got to see her, when I walked in the room, they were finishing getting her ready and stuff, and it probably wasn't even 10 minutes, she was sitting up in the bed wanting to throw up. They gave her something so she wouldn't throw up. She just laid there and rested, and within 8 hours she had a seizure. They took her that night to the
neuro ICU.
There you go. She said that. I'm going to tell you, those nurses in there, they could explain everything, and those nurses were really good to us. And they explained it, they went through it. They were like, well, you should be seeing this in the next day or two. Everything's going on schedule. She got really wonderful care of here.
While I was in the hospital, I do remember OT, physical therapy, and speech therapy.
They taught her really how to do her basics again, letting her bathe herself and getting used to everything. And then they put her on the treadmill. She loved that. They actually let her bake cookies. She baked cookies, letting her use her hands and stuff. You did a lot of work on spelling and reading.
Yes.
It's such an amazing story, how we've worked so hard to get this system up and running and well-oiled, and best we can make it happen efficiently. And when you see it happen and it saves someone, gives her a second chance, it's just amazing.
It's amazing to see her, and I'm really happy for her. I think to me it's what we do, and we try to do the same thing every single time, and this is kind of really nice to see.
Any of your family needs help or needs care, don't hesitate. Come to Grand Strand, because you'll get the care you need and deserve, because they're going to be the helping hand. And they have a heart that matters.